Hi, I'm Nurse Jamie, aesthetics nurse specialist and beauty expert. I want to tell you about a revolutionary new technology for non-invasive fat reduction, cellulite reduction, and body shaping. It's called the iLipo. The iLipo is a revolutionary new treatment for non-invasive fat reduction and body shaping with up to 4 centimeters of loss after each treatment. Now you can achieve the results of liposuction without surgery. iLipo incorporates over 32 advanced lasers that safely penetrate the skin and are absorbed into the fat cells. This stimulation opens pores in the fat cell wall and breaks down the fat cell contents, allowing the fat to escape through the pores. The fat cells then shrink and collapse, and the excess is then safely removed by the body's natural metabolic process. During your treatment, you simply lie comfortably on the treatment table. Your technician will place the laser pads for 10 minutes on each area. A course of 8 treatments is recommended over a 4-week period. You may feel a gentle warm sensation as the laser works to release fat. After each treatment, exercise is recommended to accelerate the removal of released fat from the area. You can return to normal daily activity right away. It's that simple. Infrared laser vacuum massage is performed after the laser treatment to enhance lymphatic drainage, mobilizing the release of fat from the target area. This also enhances circulation in the area. It promotes collagen growth and assists in the breakdown of cellulite tissue to achieve a slimmer, firmer, and smoother looking skin. Smaller treatment pads are available to target specialized areas such as chin, neck, or bra strap area. What may take you 8 to 10 months to lose at a gym with intense exercise and diet, the iLipo can achieve in 1 month. It's really like an accelerated personal trainer in a machine. The iLipo can specifically target stubborn fatty areas and truly sculpt according to your wishes. The iLipo can achieve significant inch loss, and combined with a sensible diet and exercise program, these results can be further enhanced and maintained. The iLipo is safe, effective, affordable, and helps to improve your health and well-being for years to come. For more information, ask your provider how iLipo can get you in the shape you want.
We're tackling your biggest body and beauty dilemmas today with the Doctor's Beauty Bowl. And who here would like to take inches off your thighs in an hour without surgery? We have a few takers, Dr. Lisa.
Yes, I'm a taker too. But Dr. Orton's back in our procedure room, and he has an absolutely brand new solution for us.
I do, Dr. Lisa. We're back in our own procedure room. I'm here with Dr. Stephen Ronan, our patient Aubin, and we're talking about iLipo. This is a new technique, and we're addressing those 2 dreaded things women don't like, both of them excess fat and those lumpy bumpies, cellulite. I like to call cellulite fat gone wild. Let me explain to you what happens. Normally, our fatty tissue is held in place by a nice firm dermis. When that dermis gives way, this is what happens. Those fat cells pop, creating that uneven, lumpy, bumpy surface. We don't like it. That's why we have iLipo, a new technique specifically designed to address both of those problems.
Excellent. This actually has 43 lasers. 40 of them are designed to work on those fat cells. They cause them to dump the fat out into the bloodstream the same way you would do in a normal physiologic process. The other laser works on those fibrous bands that are causing the dimpling in the skin. We expect with one procedure, we'll remove about 1 inch of circumference. And so the procedure can be repeated 8 times to maintain a lasting reduction in circumference.
And I know a key part of this equation is you have to work out exercise afterwards to get to rid the body of that excess fat you've melted down.
Absolutely. Once we tell that zone to dump all the fat out, we don't want it to just go back into cells. So we go right from here to the gym and burn it all off.
And Aubin, while you're working here, we're going to show the audience what kind of result you can expect after going through a series of iLipo sessions before and after. I mean, I'm looking at that picture. I mean, that looks like she had a tummy tuck almost.
Yeah, it's pretty significant. And so 8 treatments and then going right to the gym and working it off in about 45-minute session with a trainer.
Still quite
Good
impressive.
stuff. Well, thank you so very much.
Welcome back to the Morning Blend. Well, how would you like to lose unwanted fat without any surgery or downtime? Check out these before and after photos, and it's proof. You see it there. iLipo is an alternative to traditional liposuction.
Dr. Stacy Kaiser and Andrea Salter are back from A Younger You Medical Spa with all the information on this exciting treatment. Welcome back, ladies.
Thank you. Nice to have you.
For having us. I think that picture is dramatic and speaks, volumes of what this procedure can do. What is iLipo?
So iLipo is a non-invasive treatment. It's a laser that's placed on your skin, and the laser is about this big. It's got about 4 paddles this big. It emits a wavelength that triggers a fat cell. A fat cell is going to look like this. It's going to be round, and when you place those paddles on it, the fat cell is actually going to get smaller. It's going to shrink. The laser is stimulating that fat cell to release all of its contents, to release all of its triglycerides. After it releases it, you're smaller. It's immediate. People do a treatment, they come in, we measure them before the treatment, we measure them right after, and it's not uncommon to lose a couple inches even after that very first treatment.
Wow. Is it painful? Is there downtime?
It's not painful, there's no scars, there's no downtime. It just feels a little bit warm when those paddles are on, maybe like a light heating pad.
And is it safe?
Very safe, very safe. There's really no side effects to the procedure except for you're smaller than you were before it started. So,
what's typical for someone to lose? Say the midsection, I'm sure, is a popular area for people to use the iLipo. What can somebody expect to lose combined?
Midsection is probably our favorite area that people do, and it's going to be proportional to how big you were before it started. So if you were about a 30-inch waist, you're probably going to lose about 3 inches, 3 inches, and 3 inches.
Oh, wow.
Because we will measure you, all the way down to like through the hip area. So you'd lose 9 inches total. 3 on each measurement would be typical. If you're 40 inches starting, you might lose more like 4 inches, 4 inches, and 4 inches.
Okay. I think that's going to sound great to people, in terms of, targeting those specific areas. When you do that, how long does it take? How many treatments are you looking at? And I know you said there are some immediate results, but how long overall to achieve maybe your goal?
And Andrea actually had it done. So I can let you, that was her picture that you saw. She's one of our estheticians.
Really? That's
at
amazing.
The spa, and she can.
You have children?
I do. I have 3.
Okay.
I have 3 kids.
Yeah, because a lot of people, that's going to resonate with a lot of people, I think.
Yeah. And after that third one's a little harder to get rid of all the excess belly fat.
What did you notice with your treatments?
My treatments, we did 3 the first week, 3 the second, and then 2 treatments the last week. So me personally, my loss was slower in the front, and it really got stronger towards the end. So after my 6th treatment, that's actually, the picture you have is after my 6th and not my 8th.
Okay.
So that's when I really felt it, and that's when I could start fitting in all to my old clothes again.
And what about total inches? Do you know how many inches you lost?
Almost 15 inches in the 3 measurements.
Wow.
So I went from a very tight size 14 to a pretty tight size 8.
Wow.
So.
That's amazing.
Well, and like you said, I think that resonates so much with the midsection for many women. What other areas can you treat?
Typically, the midsection is by far the favorite. I would say that's what most people go in. And thighs would probably be the second choice for people. You treat both thighs in the treatment. It takes 10 minutes on one thigh and then 10 minutes on the other thigh. We can do about anywhere. We can do arms, we can do calves. I've seen people where they get kind of bulky around their knees, or they get a little bit of fat around their neck area that's hard to get rid of. There really isn't any place that you can't treat as long as we can get those paddles on it.
Is it long lasting, or is it something you have to do, say, every 6 months or a year?
Long lasting. Occasionally you'll have people who want to come back and do a maintenance treatment that they feel like they would just like to add a little bit more to their original results, but it would be just like you exercised it off. So if you took this next year and you exercised all year and you lost 3 inches, you would be at the same place.
So the skin itself is not going to be all loose. I mean, do you have a little bit of tightening with the procedure too?
You have a little bit of tightening. What I see, which is amazing, is you can actually get some improvement in scars. A lot of times after you've had children, you can get some stretch marks that can be difficult to get rid of. With this, we've seen improvements in the scarring also.
Is 8 treatments enough to do what you did with your midsection?
Absolutely.
Wow. And that you did that over the course of 3 weeks. So you did 3 treatments 1 week, 3 treatments another, and then 2 to finish up. And in that amount of time, you lost almost 15 inches?
Yes.
That's unbelievable. That's really incredible. And at the time that people are having the procedure, do they need to supplement with drinking a lot of water, eating healthy, things like that?
Exactly. We recommend that for everyone who walks in our door, but especially during those 3 weeks. We encourage you to drink those 8 glasses, at least get up to that 64 ounces per day of water. And actually, after each treatment, we have an exercise bike. So your treatment may take 20 minutes, but then we ask if you don't mind to stay and ride our bike for about 20 minutes, and that's going to help with the treatment also. It's going to help increase your circulation and remove all those triglycerides that were just released.
That's very good. I love
Thanks,
it.
ladies.
Nice to have you. Thank you.
You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
Well, in the Health Wire, we're all familiar with liposuction because we have it done around a lot. We go have our liposuction done on a monthly basis. No, I mean, we've done stories on liposuction.
It's just been around for so long.
Yeah, I've never had it done, but I could use it.
No, you're fine.
I'm just going to skip lunch.
Okay.
Okay.
You do anyways. This morning we're checking out the iLipo. It's a new technique where lasers are used to help melt the fat away, all those unwanted pounds.
Christy Siefkin shows us how this procedure works. Christy?
Well, good morning, guys. I am sure you've heard of the iPad, the iPhone, but what about the iLipo? Now, this is not an Apple product, but it is a new tool on the market to help you lose unwanted fat. And Tim Murphy is with me this morning to talk about this wonderful procedure. Good morning to you. And the key to all this is the laser. And you were showing us this paddle a little earlier. Tell us about what this does.
This is the paddle. We have 4 paddles on our laser. And what this does, it allows you to choose where you like to have the inches lost from your body. For the first time, we can choose where we want to lose and have spot reduction. So, for example, what happens is we put this laser onto our wonderful
willing victim.
Our willing victim. And we'll turn on the laser. You can tell the laser on with the pink light. And what happens here is the laser will go in and it will poke holes in the fat cells, removing the glycerol and the triglycerides, and allows you to then work off all that fat energy the next half hour right after your treatment.
Wonderful. And that's a key component here. It's not just laying on the table and having this do all the work. You have to do some of the work, too. And we saw some of that out in the room outside. Tell us about the workout component.
Good point. Right after you're done, the laser removes 400 calories of fat energy from wherever you want to work.
Okay, great.
Okay? And now it's in your bloodstream. It's clean. And it allows you to go right out. You go out, you get on the treadmill, you get on the elliptical machine, and you work it off. And so right then, all that energy in the area that you don't want is now removed and reduced from your body.
Great. So those of you who think you can just lay on a table and kick back, not quite that simple. You've got to watch the diet, do some exercise, and sounds like repeated sessions as well. How many times should someone expect to have to come in to really see some results?
Sure. Good question. Most people come in 8 to 10 times, and they come in, and sometimes if they need a little more, we'll give them a little more, but 8 or 10 times over a 4-week period.
Well, that's great. So people can come and check this out, and it looks like Deborah's actually pretty relaxed over there, not in too much pain. That's one of the other things that you pointed out.
No pain. There is no pain. There's no heat. There's no cold. It just sits on your body, and the laser does the work. There is no pain, no downtime, no nothing.
Well, we'll let Deborah continue to get all those fat cells zapped in her body and let her head on out and get some exercise. And I like to point out, too, that Tim said he got the procedure and is looking pretty good. So
I'm in my skinny pants.
We may have to try this out ourselves. Thanks so much, Tim, for your
You're
time.
Welcome. Thank you.
Of course. Back to you guys.
Okie dokie.
Welcome back to Colorado's Best. I'm Paula Haddock here at Denver Laser Solutions inside the Denver Athletic Club. I'm here with Bonnie Bauer. Now, Bonnie, you are a laser lipo specialist. You're also a personal trainer, a CrossFit trainer.
That's right.
And we're talking about iLipo today. This is so exciting. This is just revolutionary.
It is. It's amazing.
Now, we've got Jody on the table because lipo laser, iLipo specifically, is just so incredible. It's working wonders on men and women.
Yes.
What is it all about? What is iLipo?
iLipo is a cold laser therapy machine that stimulates your fat cells to secrete fat into the bloodstream, and then you're utilizing that fat as energy. So it's pulling fat locally from whichever target area that is your trouble spot. So for men, typically it's the pec area, or the abdomen area. For women, we have a lot of trouble with, you know, lateral thighs, medial thighs, or the stomach.
Yeah, for men and women, it seems to be the midsection area, you know, the mid-torso.
Yes.
All right, well, as you get to work on Jody, kind of tell us about these paddles. What is it that they're doing? And it looks like I've seen it in action that you can actually put it directly on the skin.
That's right. So our machine has, the lasers are separated into different columns, so it doesn't look like you have one gigantic piece of fat removed from your body. So the fat actually will shrink and then shrink and shrink and fill up the empty spaces. So the panels will sit directly on the surface of the skin. We do 2 placements per treatment. A placement is a total of 4 panels.
And typically, how long does one treatment last?
A full treatment lasts approximately 45 minutes, including the lymphatic stimulation that I do. But the actual time that the paddles sit on your skin is 10 minutes per placement. So it's a total of 20 minutes of actual laser treatment.
Yeah. Now, when we're talking about this as being a revolutionary treatment, Chromogenics UK invented iLipo. They have been in the laser industry for 25 years, and this particular one, iLipo, has just been voted the best slimming treatment for 2010 and 2011 in Paris, France. That's incredible.
It is. We're also FDA approved to shrink the circumference